I want to introduce Zach. What we thought here, we shift gears a little bit. Zach is also a first-year PT with us here at Pappas OPT, and he is also in his orthopedic residency. But rather than be redundant and talk about his experiences in the residency, we thought we'd shift the attention a little bit more to clinical mentorship. I know I was fortunate to go to CSM this year, and I spoke with a lot of students and new grads, and the amount of times I heard how important a mentorship program was to them, it was like over and over and over again. And I'm thinking, well, I hope every single employer here offers a mentorship, because this obviously is pretty important. And one of the things that, I gained is, well, what does that mean? Like, what about the mentorship is important? How is it structured? And we've taken that internally at Pappas OPT and asked ourselves that question to make sure we're following through with what we say we do. And what we thought we'd do here is just have Zach speak a little bit to his experience in the mentorship program. We'll talk a little bit about the differences, which I'll go into in a second after Zach introduces himself, but the differences between the mentorship required for the residency program and then what we also offer separately as our standard clinical mentorship. But first, Zach, I'll let you introduce yourself.
Thanks, Dan. So yeah, again, my name is Zach. I am a new graduate, also in my first year of practice. I graduated from Plymouth State University in May of 2023, and I started my residency also with Lucas, as we're in the same cohort in January. I'm currently I think we're about 2 weeks shy of the halfway mark, which I can't believe has gone by as fast as it has. But yeah.
Awesome, thanks. Yeah, so the mentorship program, which we'll dive into with Zach, is related to the residency, is a little bit more, I don't even want to say structured, it's just a little bit more in depth than our standard mentorship program. So as part of the orthopedic residency, all residents are required to have 150 mentorship hours with a mentor who has their orthopedic clinical specialty. Those hours include a combination of kind of co-treating patients, or, the residents treating, the mentors kind of observing, jumping in, giving feedback, as well as time to like debrief and talk through caseload and things like that. We also, for our clinicians who don't jump right into the residency, we also offer a mentorship program that we found to be very valuable. It's very similar. Your mentor may not have their OCS, but they're still going to be an experienced clinician who can speak to kind of different patient caseload diagnoses. We structure one-on-one time where you go over the caseload, you practice manual therapy skills, and really we try to structure it based on, what the new clinician feels are the strengths and areas for potential improvement. In addition to that, we really lean on those core 4 courses, those weekend intensives, which we encourage all of our new clinicians to go through and take some of the content out of those to spend more time together practicing those manual therapy. We found to be, again, pretty valuable. So Zach, first question for you, again, going back to, before May, when you were looking at where you were going to work for your first job, how important was clinical mentorship as a deciding factor for that first job?
It was honestly a super important choice. Like for me, I mean, like, plenty of places offer mentorship, but I've I guess I could just speak to just in the surrounding area or just in other previous employment experiences I've had, was some mentorships, like they say they offer mentorship, but they'll just sit you down and talk to you about billing and scheduling, but or how you can get more patients in and stuff like that. But it was super important to me to, again, I started a residency because I wanted to be the best PT I could. So, having good mentorship was very important to me. And that was definitely something I saw with you guys.
Yeah, that's great. Well, I think it goes back to what Adrian said earlier, right? You're working on your craft. You can very easily come in, graduate, and just say, I'm going to start seeing patients and I'm going to just crank it out and get into a pattern, get into a flow. Obviously, for both of you, jumping into a residency program, you care, you want to be experts in your field. So that's great that was important for you. Looking at your mentors, I know you have multiple plural now. Were there any specific attributes or things that you were looking for or looking to get from your mentor when you first started?
I don't know if there was anything. I guess you could say, I mean, there were a few things specific that I would like to get. I mean, I think something that this is like coming straight out of school, something that I always wanted to get better at was like the ability to generate, a differential diagnosis list. I think that was, the whole process of, ruling stuff in and ruling stuff out was something that always needs to be refined. And I think that's probably the biggest thing. But yeah, no, I've had multiple, mentors, which I don't personally see as a negative thing. I think that, for anyone else, who's listening in today, I would say that, take it as a learning opportunity to really just kind of, take a little bit from everything. I think, residency and mentorship is like, it's what you make of it. And if you're able to, nobody's good at everything, right? And you want to obviously take the stuff that you like, you enjoy, so that you can kind of, it's for you to use it for you.
Yeah, it sounds like it, trying to take pieces from each mentor, right? Like, and add them to your toolbox. Kind of like what Lucas had mentioned earlier, some of the benefits of like the weekend intensive courses is the meeting of the minds, right? You take little clinical pearls from everybody you interact with. I think you probably had the experience to learn from obviously your colleagues, your clinic manager, clinic director, but also having a few different mentors. You've been able to kind of pull pieces from everybody and add it to your toolbox. So I'm sure that's been helpful. Yeah, I know you talked a little bit about, differential diagnosis and going through that as one of your goals or something that you had attention on when you graduated. Can you speak a little bit more to how the mentorship experience so far has changed or adjusted your evaluation process and approach?
I think one talking point, that I like have really, has resonated with me, I think was, your reasoning in like your subjective exam. I think, one of the first topics of like clinical decision making that they really want us to utilize is hypothetical deductive reasoning. And for those listening, it's like they want you to think in terms of like, okay, if I have a diagnosis in my mind, like when you're having the conversation and you want to think, okay, if I perform this diagnostic test, I should expect to see X. That and then that way you can kind of, and if no, you move on and you kind of can rule things in and out that way. That was something that really resonated with me. I think really yeah, using the subjective exam to create a hypotheses list, and then once you have that list going on in your head, you really want to condense it using your the hypotheses list in your physical exam to kind of rule in and rule out diagnoses. And that's going to drive your interventions, and then your plan of care.
Awesome. And do you feel as though, yeah, and again, I know you're right in the middle of it right now, so it's not like you're at the tail end of your mentorship looking back, but has the experience of, having a mentor sit in on an evaluation or doing your eval and then debriefing after, here's what I found, here's what I did, getting that feedback, has that been valuable? And if so, how has it been valuable?
Yeah, I think it's been it's been crucial. I think like, it makes you quite literally question everything. Why you do what you do, why you make a decision, but in the best way possible. I mean, yeah, I mean that obviously in the best way possible. I think that knowing, I mean, it's the effect of knowing you have eyes on you the entire time, but it forces you to be better. It really does, and make sure you rule out that that red flag, or make sure you confirm a possible diagnosis with a follow-up question, something like that. If you see a patient moving around, like in the chair, trying to get comfortable, ask, if, one position feels better than the other. It makes you think about everything. And I think that's really the best.
Awesome. And then, moving on from the evaluation, obviously you get your information, you get your data, you formulate a plan, you start to implement some interventions. Again, I know you've had the experience of having your mentor there during treatment, giving their input, giving their thoughts, repositioning patients, things like that. What type of impact has it had on your ability to, or your shift in treatment style and how you approach your interventions for follow-up visits?
It's a good question. I would say it really helps me again, because my mentors have helped me to, number one, identify the best evidence for what to use for that, and helping me decide what manual intervention to use. Okay, say they needed to improve range of motion, at their cervical spine, what are you going to do to reinforce that? Adding in maybe like a cervical snag or something of as an example that way. It just yeah, I think that's one example I would use.
Yeah. Yeah, it's interesting. I mean, I found for myself, even not even being a mentor, having a conversation, it's so funny how when you're working with a patient, whether it's an evaluation or a follow-up, it's very like cognitive, right? Like you're doing a test, or you're doing the physical exam, and you're just thinking, all right, or if this is positive, what does that mean? If it's not positive, what should I do next, right? And sometimes it's easy to lose focus or track of how is the patient doing, right? How's the patient positioned? Do they grimace? Do they look uncomfortable? And I think, I've seen the benefit of co-treating with somebody else is you have another set of eyes to be like, hey, just so you know, when you did that, the patient looked a little uncomfortable, or you might have changed your sequence a little bit. So, I know from my experiences when I started out working with mentors, it was always, and even as a student, right, it was always helpful because I know I'm thinking, and sometimes you're not paying attention fully to the person in front of you. And I know I've noticed specific value in getting that feedback and having conversations after the fact. So say, all right, yeah, next time I see that person, I'll make sure to make that adjustment. And having those, again, for the residency, 150 hours is a lot of hours, right? So you have a lot of opportunities to get some of that input and some of that feedback. Can you speak a little bit, Zach, to what effect, if any, mentorship, working with your mentors, has had on your manual therapy skill set?
Manual therapy specifically? Yeah, I would say so. Number one, the weekend intensive courses have been huge for that. I went to the cervical thoracic disorder, which was actually taught by Allison. And I walked away feeling like very confident from it. We do, round robins, and it's just repetition after repetition, because that's what makes it sink in. And yeah, I can't say enough nice things about it, honestly. Yeah.
Awesome. And then I know you've had some time in the clinic to practice those a little bit with some of your colleagues, with your mentor. Yep. I only know because I've seen it. I've been in there, so I would imagine getting those extra reps. You do a CPA move on a patient, then you practice it in your colleague and get some feedback. I would imagine has been valuable as well.
Yes, definitely. Yeah. We, part of those like weekend intensives, we have to, there's like a checklist that we have for like all these different skills that we need to be, provide at least adequate competency with, adequate or exceptional. And my mentor sat down with me the other night after my upper extremity course, and we just kind of went through the whole list again, and just kind of got feedback from that, pros, cons, things I could change up, things I did well. Yeah, and that's been huge for me.
Awesome. And just briefly, I know Lucas spoke a bit to confidence, right? And how much confidence the residency program's given him. Can you speak a little bit to that? And it can be in relation to either the residency program or your experiences working with your clinical mentors and how it's shifted or shaped your confidence when working with your patients.
I definitely feel more confident. Again, like I feel like you know, I feel like I guess I'll compare it to PT school, because that's my experience so far. But like in pure volume, like I think you learn more things, like what to do, like evaluative wise and treatment wise, like in PT school. But you really get to like get into the nitty gritty of like the details of with in the orthopedic residency. That's when, like, if you read about how to use a hammer in PT school, you didn't really know how to really use the hammer until you got into residency. It was a metaphor.
Awesome. So really just refining and honing in on those skills that you brushed over, that you practiced in school, but you may have not had the reference point that you have now when you're working with patients and actually using them on people that aren't just, all 20-something-year-old classmates. You're actually using them on patients who are in
Right.
pain and who have, certain limitations and impairments. Awesome. So last question would be, as similar to Lucas, somebody who's looking at graduating, looking at their first job, any advice you would give them in regards to pursuing a mentorship program and making that as valuable as possible?
My honest advice, I would say, is be a little picky. I mean, like I had I certainly didn't have any issue working with anyone, but I wanted to make sure that I had that dialogue and had that conversation with my mentors before they agreed to take me on and everything. And again, Ed, based on the responses, was very happy with it, because only what you need, and you want to make sure that that person can really provide that for you. Again, like you want a mentor that can sit down, block off a time on their schedule to really discuss concepts taught in the courses, patient cases, decision making, manual skills, post-op protocols. You want, I would say, you want a mentor that understands that the better that they can make you as a clinician, the more value you're going to have for that clinic
Yeah,
and
I
for the
think
patients in the surrounding community. So, yeah.
that's well said. Awesome. Well, thanks for sharing your experience. I appreciate it.